Tēnā koutou katoa and welcome to eHealthTALK NZ. I'm Rebecca Macbeth, I'm the media editor at HINZ, and today I'm joined by Pete Booth. He's the Chief Information Security Officer at Health New Zealand Te Whatuora. So, lovely to have you on the show, Pete. Cybersecurity has become a bit of a hot topic in 2026. We've seen several high-profile health data breaches already this year. So what does that tell us about the wider health sector and its vulnerability to breaches?
Oh, kia ora, Rebecca. It's great to be here, and thank you for inviting me on the podcast. 26 has been a really interesting year. I have had a chain of incidents, and unfortunately, in the health sector. Obviously, Manage My Health, a very high-profile one. So what do they tell us? Well, there's a few things happening, and one is that there's just more work to be done. Being in security for many years, there's always a sense of, well, if something happened to someone else, that was good because it wasn't happening to you, you know. But in this case, it's very much part of the health ecosystem. And that's one thing which has become very clear very quickly is that a health data breach anywhere in our health sector or health ecosystem is very serious, and we have to respond to it no matter whether or not we have direct or indirect responsibility. There's certainly a shared responsibility there in terms of how we approach it. There's a lot of, well, what next? How could we improve things? What are the things we need to work on to make things happen better or not happen next time in that way? And I think a focus on third-party providers, certainly key. Third-party risk management, that's a big program that we're going to be focusing on going forward, looking at our supply chain, understanding where, if something goes wrong in our supply chain in terms of health, what that can do to other critical systems. So I think this all gives us great areas to focus on how we can improve things moving forward.
And do high-profile breaches like this, while I'm sure they provide lots of extra work and potential stress, are they also helpful in some ways just to concentrate people's minds on the importance of cybersecurity and really start those conversations?
Yeah, that's a silver lining of a very dark cloud. If you work in security, that security incidents do bring you to that cutting edge of what an incident can do. Obviously, health experienced one of the worst breaches that it had seen in a while in Waikato in 2021. It was very, very impactful. So obviously, that's a real worst case scenario for us from a security perspective. And I think that's stayed long in people's memories because it was so severe. But I think we are now seeing this new whole supply chain aspect to it as well, where all of health is really important. And it's such a complex ecosystem now. We've got the primary care organisations, the service providers that support it, the vendors that provide services as well, and Health New Zealand in the middle of it all, and the Ministry of Health.
Like you said, there are a lot of organisations involved, and Health New Zealand did recently send a joint letter to providers reinforcing your expectations around protecting patient data. What worries you most right now about those third-party providers' ability to protect the data that they hold?
Yes, that was a important part of the Manage My Health response. Effectively, what it really was looking for is for people to pay attention to the health information security framework in the first place, but then we also wanted to give some guidance, and that's where the more recently announced NCSC minimum cybersecurity standards were very helpful because they've introduced a cyber maturity model which allows us to ask people to reach a certain point, which would mean that we feel they're able to share data, look at data. There are some who are doing very well, and then there are others who still have some way to go. It's fair to say that it's more of a stretch for the very small organisations where they maybe don't have too much IT support or maybe just have one vendor looking after them from that perspective. We're really starting the journey in terms of data sharing and security. We want to uplift that, the introduction of a self-assessment to the NCSC's minimum standards, level 2, which is what we're looking for. But the other thing is work as well that we're looking to do with GPNZ, the Royal College of GPs, on foundation certifications. So yeah, there's a lot happening, and these are all things that we need to do, which really raise the security maturity within the overall sector.
The letter, like you said, calls out quite basic things like access controls, multi-factor authentication. Why are these such critical issues still?
I think there's always a balance, but I think in health it's slightly different in that there's a clinical aspect to it. So a lot of the times when we're doing reviews or we're talking to vendors or we're talking to people in our own organizations and we're talking about MFA in particular, it's one of those things where prior conversations might have said, well, if people have to do MFA, they might not be able to access the important medical information that they need, or it might be harder, or certain segments of society might not be able to access via MFA or even have a phone. Lots of those kind of things come up. But really, I feel these latest events have changed that narrative somewhat. It's more of an expectation now. The 2020 Privacy Act does state quite clearly that it's an expectation that MFA is in place. Otherwise, you haven't gone far enough in terms of adequately securing the information that patients might want to access.
At a recent event, we had a cybersecurity panel, and something some of the CISOs said was the need for even small providers to have just really what they call grown-up conversations with their vendors and just set out what their expectations are around cybersecurity. Do you think some organisations struggle to have those, what potentially might be a slightly difficult conversation with their industry partners? And what advice would you give around having those conversations early to ensure that, you don't hit problems down the road?
Yeah, it's just being aware of having good cyber clauses in your contracts to start with. Also, sometimes the vendor might feel that they know best because they've done it that way in other countries or in other places or to other customers, and feel that they know how it should work. But I think we need to be very clear in the health sector that, we have very, very strong expectations around the protection of health data and the patient information. It's not quite the same. So we just need to really lift up there and empower people. I think having a good understanding of the standards and the minimum levels that we expect people to meet does empower any organization to have that conversation with a vendor to say, look, this is what we're being asked to do. We need you to do it too. Really lift it up all at the same time. I think that's one of the good things that's coming out of this conversation we're having. One of the great pieces of work, which a member of my team is doing, is looking at the level 2 assessment requirements that we would expect people to meet for data sharing and turning that into plain English assessment. So it's not just cyber tech speak that people are looking at. I think that's really helpful. How can we reach out, turning it into a plain English conversation about how we can improve it overall from a security perspective.
It can be a bit intimidating in terms of the technical aspects, but also just a bit scary, really, in terms of what the impact might be. So I imagine it might drop to the bottom of some people's lists of things to do during the week. But I think we all know trust is central when it comes to digital health. So can you just talk about what's the impact when that trust is eroded, both for patients but for the system as a whole?
One of the things that's different about health is that your health data is very unique. It cannot be changed. It is what it is. And I think that's what makes it very attractive to the cyber criminals as well. They feel that if they can get hold of this health data, that's far more likely that someone would pay a ransom. And that's been borne out in the stats that we're seeing around the world at the moment. Yeah, so it's just really stressful for those involved as well. So there has been, it's been described, and I have seen this in print somewhere, as somewhat of a feeding frenzy around health. Certainly that's what it's felt like at the beginning of this year. And it is really unfortunate. It really does erode people's faith in the health system, and we just need to do better in that way. It has to be core to how we approach security, protecting the patient information, making sure that these critical systems that support people in the highest need moments of their life are actually going to be there and available for them. That their appointments that they need to have for very specialist care, that those appointments will always be made. I think it's just, we live with it every day in terms of security. I think anyone who works in health, especially digital services, understands there's a real responsibility there to help and make sure that we're doing the right thing as much as possible.
Yeah, as you said, healthcare is under constant attack. I've heard numbers before, and they are quite shocking. So, what does good look like then across a large and complex health organisation like Health New Zealand?
That's a really good question to ask. We've come from 20 different DHBs, 6 shared services. We're now one organisation. So having visibility around that environment, massively important. So we need to have common platforms. We need to have things which a limited number of resources can work on, our kamahi can really get behind and be really good at is amazing. We need to do that on a modern system as well. When we think of the investments that we're talking about in the digital investment plan about modernising our platforms and really bringing that up, raising everything up, that's really important for cybersecurity as well. We don't do it alone. All the systems working with each other and that visibility. But then really when you think about Health New Zealand, it's over 80,000 people work here. It's massive. We've got 90 or so hospital environments that's spread geographically across the motu. So scalability is just huge. How can we scale up our services? We need to really look at smart and efficient ways that we can scale up the services. And in order to do that, yes, we have to look at things that are automated, AI, how we can use that, but ultimately just make really smart decisions around those platforms that we choose to work with. We've got some really great things that we have managed to roll out over the last few years, and we're looking to just keep building on those. I think that's the most important thing. But what does good look like as well? I think we have to take into account security maturity. We measure our security maturity on an annual basis. We're really looking to drive things up. We map against the areas where we feel we don't have enough focus, and we push initiatives and we drive up those programs at the same time as well. So it's a key area. I think in the top 3 risks of most organisations, but certainly in health, cyber is right up there as a key risk, which we're expected to report on a regular basis. So I suppose that just gives you an idea of some of the things that we focus on to make sure that we're doing our best and providing the best service we can for Health New Zealand and the wider health sector.
Yeah, it's certainly a journey, isn't it? The cyber criminals are certainly always evolving, so it makes sense that organisations have to as well. You've talked about the National Security Operations Centre, but can you just, for those listeners, just explain what that is and how it strengthens the sector's ability to detect and respond to threats?
The National Security Operations Centre is a really great success story. After the Waikato incident in 2021, there was a Treasury investment in Health New Zealand, and we had 4 years of that. And in that time, we managed to basically create this whole new operations center, which has been fantastic. So what that means is we've got one core system that effectively takes signals from all those different environments, and we have our security operations center, which manages to look at those. They look at the highs and the lows and the mediums and all the things that come through, and then effectively, when something does go wrong, we have cyber security incident response teams, incident management teams who can kick into action. And it's been very successful. It's been one of the key protections that we've managed to roll out for Health New Zealand. For the wider health sector, yes, we continue to work on that. On some of these bigger incidents, we'll be working with the NCSC, we'll be working with other government agencies. We really pull that together in terms of a response capability. So it has come a long way. When I think back to when I first started at health, it was just pockets of good, other pockets of really, no one's doing anything. So to have what we have today is something that we look forward to building on as we move forward.
Yeah, and you've also talked about, health is a connected system. So if there's a weak link or a breach somewhere, possibly outside of Health New Zealand, the impact is felt in other areas. So how do you at Health New Zealand help to build capability across not only hospitals, but primary care and community providers, just to make security everybody's responsibility?
It's an area we're moving more into. I feel like it's something that Health New Zealand has had to grow up in terms of our cyber capability itself. It's sort of like when you're in the airplane and they tell you to put the mask on first if something goes wrong. And if you put the mask on first, you can help the others. We've kicked off a health security information exchange, which has been fantastic. That allows us to speak to other government agencies, some private providers, PHOs and others have joined that, and that's been really good. So from a security perspective, we can talk to each other about what we're seeing in the environment. That was started with small shoots, but we are now seeing some really great things come from that. Also, there's awareness campaigns. There's a information sharing and security awareness initiative kicking off in the primary care space, which will be very, very good. That's going to really talk about some of these new standards that we want to implement. When I think of security, I always think of it as a bit of a security sandwich. You've got the awareness on one side, all the raising up people's awareness and giving them good training. We're rolling out more training, so when people get onboarded, they know what their cyber responsibilities are. And then at the other end, how do we support the whole health environment when things go wrong? That's the incident response part. But in the middle, we have this big chunk of things which we're doing, which are really important. And we would love to start seeing, more services being made available to primary care and others. And that's something which we'll be certainly working on as we move forward in our journey.
Excellent. We look forward to helping to share those with the community as well via our media channels. So just finally, what should health organisations be doing now to stay ahead of the emerging cyber risks? And especially as we become more reliant on digital systems, and now we've also got to deal with AI.
Yes, AI. From a broader perspective, health is at the forefront. When you think of health organisations around the world, and certainly here in New Zealand with the HealthX initiative that we have, AI is a game changer. So from a security perspective, we can't sit back here and go AI is bad. It's like, no, AI is here. We have to manage it. And how do we do that in a safe way? How do we get the foundations right? How do we get the guardrails right so that we enable our organisation to adopt these amazing AI solutions, which are making massive differences in the areas of radiology. Lots in the media this year around Heidi. I was just in Wellington ED actually during the week speaking to the CMO, and he was saying that a lot of the people have just really embraced the scripting service and what a difference it makes in terms of the emergency department there. So things like that are just going to keep coming. The wave is here. We are seeing a transition now in terms of how we work. I was watching a really interesting presentation and it was talking about, we're all going to have our personal agents working for us going forward. Everyone's going to be writing code or not writing code. They're going to be making apps because they just can. And then we have what's called the agentic integration, where agents who speak AI, who are basically our AI, are talking to each other, interacting in the systems that we work in as well. So, so if you work in security, it's not going to be dull. It's going to be a very, very busy year, I think, and AI is a massive driver in that way. It doesn't take away from the more traditional focus areas. I think, third-party risk management, data loss prevention remains big. Looking at these systems when they're getting onboarded and making sure that we've got secure by design built in and baked into how we deliver are really, really important. So yeah, it's good. I think with everything good, you have to look at the other side of it as well, and we'll be busy making sure that Health New Zealand and other parts of the health sector can adopt AI as safely as possible, and that's something we're looking at on a daily basis at this point.
We're also going to delve into some of those questions around security by design when rolling out AI at an event that we're going to hold in Christchurch on the 17th of September. So listeners can put that in the diary and expect to hear more on that soon. But on that futuristic note, I'm going to wrap it up. So thanks so much for joining me today, Pete. It's been really interesting. And to our listeners, be sure to like and subscribe to this podcast to make it easier for others to find. Mā te wā.